Thank you so much for joining our coffee break today. Um, just sort of from some administrative news and notes, feel free to go on camera, off camera, whatever you would like. If you want to put questions or comments or have a discussion in the chat, feel free to use that. And if you want to jump in at any point, I am open to that and chat and have a conversation about Medicare and healthy aging. I am Lisa Weber Rayleigh. I am the Chief Research Officer here at Greenwald Research, but I work mostly in the healthcare space. And today's conversation really is going to be focused around that intersection of health and wealth when it comes to aging and Medicare. So let's go ahead and get started. Oh, sorry, I would be remiss if I did not give a shout out to a couple of my colleagues who helped put together this presentation, Sarah and Ravneet. Thank you so much for your support. Let's go ahead and get started. So let's talk some background and table setting before we dive into some of the research that we have. So let's talk about healthy aging. When we talk about healthy aging, we first sort of think about life expectancy. Life expectancy at birth in the United States currently is projected to be 78.4 years old. That's higher for females, obviously, than males. But when you get to the point of age 65, life expectancy is 19.5 years, so roughly 85 years old. There is a new trend, a new movement right now of Medicine 3.0. So this feels very timely. Medicine 3.0, for those of you who are not familiar, is a departure from focusing on extending the lifespan, the number of years you live, and rather extending the health span, the number of years that you have without functional decline. And obviously we know that health declines happen with age. So sort of this is the landscape of which we're talking about healthy aging. Germane to today's discussion is Medicare. Medicare is, in case you're not aware, the federal health insurance program that covers 68 million adults in the United States age 65 or older, or younger people that have specific disabilities or conditions. And it has lots of different flavors, hence our ice cream photo here. And it's going to be a warm day here in DC, so maybe you'll grab some ice cream later. But there's lots of different flavors. This is a chart here from Kaiser Family Foundation, just sort of explaining the share of beneficiaries within Medicare and how they are distributed across the different programs. Also timely is that open enrollment for 2025 begins in just a few weeks on October 15th. So important to today's landscape is there are lots of different types of Medicare. When we talk about Medicare, it's not just one thing. And it is the sort of main way in which seniors, people age 65 or older, retirees, are covering health costs during retirement. So let's review some of the research that we, Greenwald Research, has sprinkled across a variety of projects related to healthy aging and Medicare and healthcare costs in retirement. It's given that background of what's happening sort of with Medicine 3.0, lifespan and longevity, and then Medicare and the different flavors and types, we think it's really important to understand how people make decisions and how they think or feel about their health, and how to pay for that health in retirement. So I'm pulling from 4 different projects here today. We have the all of which I will say, just sort of shameless plug, are available for sponsorship. So we have Greenwald Ebree's Retirement Confidence Study that is done in partnership, as I mentioned, with Ebree, the Employee Benefits Research Institute. This measures worker and retiree attitudes and behaviors. It is heading into its 36th year in 2026, and that particular year will have a focus on caregivers. We're also pulling from another project we do in partnership with Ebree, which is one of the longest running studies of privately insured consumers in the health insurance market. And it aims to provide information about high deductible plans or other plan type trends, as well as behaviors and attitudes of healthcare consumers, understanding payment models and insurance design. We are getting ready to field 2025, which is our 21st year. and we'll be releasing those results in early 2026. There is still time to sponsor that 2025 initiative. So if you're interested, reach out. We're also drawing upon Greenwald's own Retiree Insights program, which is a multi-phase program that includes a survey of consumers aged 50 to 70 with at least 200K in assets, a survey of financial advisors who help serve those consumers, and then qual work, mostly focusing on the survey work today. And finally, we're pulling results from our Medicare marketing and distribution study, which included a survey of consumers aged 64 to 68, very narrow window focused around that Medicare decision point, as well as agents and brokers who help support them in that process. So let's dive in and understand sort of some of the landscape behind Medicare and healthy aging. First up, probably not a surprise, we do know that workers expect to retire at a later age than the age at which retirees actually retire. Retirement's that key marker that most people expect to enroll in Medicare, but there is a gap between the expectations of how long one might work and when one stops working. Why the gap? There's a mix of good and bad reasons. Involuntary early retirement, like layoffs or firings, health issues or being unable to continue to work, caregiving, health issues of someone that you love or need to take care of. Good things, being able to afford early retirement or retiring earlier than you had planned. But really sort of understanding that things don't always go the way you maybe expect or plan them to is fundamental to sort of making decisions in approaching retirement. So let's start by understanding how people feel about how things might go in retirement. For the most part, both workers and retirees feel confident that they'll have enough money to live comfortably through retirement, which is a good thing. We also see that our retirees are more confident than our workers, and that is also reflected in their confidence in the Medicare system. Retirees are more confident in the Medicare system than workers for being present and there for them as they need it. When we talk to workers and retirees in RCS and ask them about their concerns as they're approaching retirement or preparedness for retirement, we see some common themes emerge here. The top concern is the US government making significant changes to the American retirement system, but also there's concerns about increased cost of living, needing to make cuts to spending because of inflation, and sort of volatility in the stock market. So sort of underlying fundamental concerns with the stability of financial planning is sort of underpinning retirees and workers' perspectives as they approach retirement or living through retirement. So what does that mean? Concerns about changes to the American retirement system. Retirees are mostly concerned about cuts to the benefits that underpin sort of their safety net, the Social Security retirement benefit, and then the Medicare benefit. Workers have a unique concern about that age goalpost. So, they're planning on retiring at 65. 65 is the age at which they might be eligible for Medicare. They're really concerned about the age, an increase to the age at which they might qualify for Social Security or Medicare. Retirees are not, because most of them are already sort of past that point. So when we dive a little bit deeper about broad economic worries to try and get an understanding, and specifically focusing on these Americans from our Retiree Insights survey that are aged 50 to 70 and that do have some assets, right, 200K or more, their broad concerns tend to be sort of political environment, inflation, recession. But you can see there that Medicare, significant cuts to Medicare, and developing a serious health condition are in the top 10. They're number 6 and number 7. So they are among those broad consumer concerns. So ultimately, I think we have a known source of anxiety or concern among consumers about care costs. and the impacts of potential federal policy shifts or changes to Medicare, which is sort of underpinning the whole system of paying for healthcare and retirement. So how do workers and retirees feel about cost of healthcare? And again, this is back to our retirement confidence survey with eBree. When we ask workers about their current state, more than half of workers report that the cost of healthcare for them currently is negatively impacting their ability to save for retirement. And about a third of retirees say that healthcare costs are impacting their ability to live in retirement. But we can see that not so many have calculated care costs. Less than half of Americans report they've tried to calculate how much money they might need to cover health expenses or to cover long-term care expenses. And importantly, the type of Medicare plan and the selection they make is a big part of projecting how much things might cost in retirement, both in terms of premium dollars, but also out-of-pocket costs. So, what do we know about healthcare costs in retirement? How do consumers plan to pay for these? How do workers, as they're looking forward to retirement, think they're going to pay for healthcare costs in retirement? We pulled some data from consumer engagement and healthcare. And this is privately insured Americans aged 26 to 64, so sort of workforce participating Americans. And what they are planning on is using sort of their own retirement savings, 401k or IRAs, but big proportion of paying for healthcare costs in retirement is Medicare and Social Security. So those government programs and retirement savings are underpinning the plans of workers as they look forward to retirement. We also know that 57% of workers say they would delay their retirement if they felt they didn't have enough to cover their expenses. But we know from RCS and our data on trends in age at retirement and expected age at retirement that things do not always go as planned, and that workers may be planning to retire at a certain age or say they want to work longer, but things work out differently for them. So what do financial advisors say? Because they have the perspective of working with multiple consumers. So drawing on our retiree insight survey, looking at advisors' perspectives about retirement risk and consumers' perspectives about retirement risk. We asked about a variety of different types of risk: inflation risk, withdrawal rate risk, market volatility risk. And the two areas where we see the biggest gap in what advisors are concerned about versus what consumers are concerned about are healthcare and long-term care risk. So that risk that unexpected medical expenses or the need for extended care could significantly reduce your savings. And longevity risk, the risk of living longer than you expected and outliving your savings in retirement. Those are big gaps between what advisors are identifying as the top risks or vulnerabilities for consumers and what consumers are concerned about. In line with what clients are most vulnerable to, when we ask advisors what retirement risks are hardest to solve for, it's those same two: healthcare and long-term care risk and the longevity risk. So that is among advisors to Americans aged 50 to 70 with some asset levels in place. So we've got anxious consumers, really anxious advisors who understand the implications of longevity, who understand the implications of healthcare costs and long-term care. So let's pivot to Medicare. What do consumers know about Medicare? And the bad news is very few Americans of retirement or Medicare decision age, so that age 64 to 65, understand Medicare and the different broad umbrellas of plan types, sort of Medicare overall, Medicare Advantage, or Medicare supplemental. We see 1 in 3 say that they understand Medicare just overall very or extremely well. And we can see that there's variation by actual Medicare enrollees. Like just for example, on the far right there, we've got 29% of all Americans aged 64 to 68 say they understand Medicare supplemental insurance very well. We've got 31% of people actually enrolled in a Medicare supplemental policy who say they understand their Medicare supplement insurance very well. So there's a clear knowledge gap or understanding gap when it comes to Medicare. Where do our Medicare enrollees turn for support? Where do they find out about their plans? Who do they use to help them through this process? Again, it is the main funding mechanism for healthcare costs in retirement. So the first source for hearing about a Medicare plan among Americans aged 64 to 68 is kind of diverse. It's agents, brokers, advisors. It's family members and friends. It's all of those mailings that trigger as soon as you are approaching that magic age of 65. It is online searching, sometimes Medicare seminars, sometimes employers get involved in preparing employees for that next step. When we look at Americans by each age range, what we can see is that while open enrollment happens every year, and that seniors are needing to make decisions about Medicare every year, whether they're going to stay on their plan, pick a different plan, we see that the rates of using or leaning on a broker to help them through that purchase or renewal decision declines each year as they get older. So that by the time someone's 67 years old and going through maybe their second or third cycle of Medicare enrollment, they're really kind of doing this on their own. So we have consumers who are very nervous about paying for healthcare costs in retirement. We have advisors who understand the risks there. We have people making these decisions, usually without support or guidance from a broker, and yet everyone seems super confident in their choices about choosing health insurance coverage. Again, focusing very narrowly on those Americans aged 64 to 68. We see 75% of those covered by Medicare are confident about choosing their health insurance coverage. That's strongly agree and somewhat agree with that statement. So we'll make sure we leave some time for questions and conversation. Let's recap. We know that health decline and care costs is a guarantee with age. We know that there's a high level of anxiety or concern about the safety net that's underlying the retirement system. We know that there's a lack of knowledge about how much to save for healthcare costs in retirement. We know that advisors, financial advisors, are recognizing the risk of longevity and care costs. We know that there's a lack of use of brokers or advisors in the Medicare decision-making process, and we know that there's a fundamental lack of Medicare knowledge among consumers. So we have a moment right now where the baby boomers are aging into retirement every single day at a fast pace. So it feels like from a business standpoint, if I'm an insurer, that this might be the moment to have that conversation about how to better serve them through the decision-making process. From a forward-thinking standpoint, we have this zeitgeist moment of Medicine 3.0, which is focused on preventive care, doing things today to extend the health span. Extending the health span would reduce healthcare costs as you age. And so there's an opportunity for the next generation, those maybe 5, 10 plus years away from retirement, to have a conversation about healthy aging. Underlying this all is, and we know this from some of the caregiving work we do, is that these are not easy conversations to have. You're talking about emotionally charged conversations about what is healthy living, and difficult conversations about decline in health, aging in place, wishes, need for care, family dynamics. So those are hard conversations to have, but they are critical sort of for that health and wealth intersection when it comes to healthy aging. So what's next? I have lots of questions and would love if anybody has thoughts about these, but what is healthy retirement? What does health span and lifespan planning look like if we were to take that lens? What kinds of advice do people need about care costs, about savings, the role of insurance or Medicare embedded within that? What's the right format? When's the right timing? What roles and supports are needed? How do you deal with the emotional component of this whole decision? Baby boomers, is it too late to have these conversations as they're aging in every day, or is the timing just right to help support them better through this process? And then the next generation retirees, do we need to do better, and how do we do better as we look forward? So just sort of shameless plug, we would love to be able to do a retiree health insights program that mimics our retiree insights program, sort of multi-phase, to look at that decision-making perspectives and action with regard to healthcare in retirement. So with that, I will pause for any questions, comments, discussion. Let me double check the chat real quick. Super. Okay, well, hopefully that was not too uncomfortable of a conversation for a Friday morning for all of us. I do thank you for joining. I want to do just sort of a couple wrap up things. We have a hub with this coffee break recording will be placed on that hub, but all of our past coffee break recordings are there for your perusal. You can find us on the web at www.greenwaldresearch.com. You can also follow us on LinkedIn. We've got lots of things going on for our 40th anniversary this year in 2025. So I encourage you to check both our webpage and our LinkedIn for those activities. And thanks for joining me this morning. Take care.